So this is a question from my follower asking about hemorrhagic stroke midline shift. So to cover briefly about stroke, there are three broad categories of stroke: ischemic stroke, hemorrhagic stroke, thromboembolic stroke. Ischemic stroke simply occurs due to blockage of a blood vessel that has been chronic and progressive due to hypercholesterol, diabetes, and controlled blood pressure. So it occludes the blood vessel so the oxygen doesn't get to the other side of the brain cells die. The second type, which is less common, is hemorrhagic stroke, where due to various causes, the blood vessel itself ruptures and blood gets distributed within the brain parenchyma and causes brain damage due to that. The third cause, thromboembolic, which is due to oftentimes an arrhythmia in the heart, where their heart sort of flutters and a clot forms in the heart, and it clot goes from the heart into the brain by occluding a blood vessel. And sometimes it can also be due to an infection in the heart. So typically surgery comes in when there is a large blood vessel occlusion, like middle cerebral artery occlusion, where there's progressive swelling adjacent to the area where the blood vessel was occluded, and the brain comes under high pressure and starts damaging the normal side of the brain that was not affected from the stroke. So neurosurgeons come in and basically take the skull off in this setting to create room for the brain to swell. When the swelling subsides, then you put the skull back in, and this can vary anywhere from 1 month to 6 months duration depending on how the patient is doing. And sometimes the skull can be stored in the abdomen. And in the US, most of the time the skull is stored in a medical grade freezer. Hope this answers your question. Follow